In 2021, the Alberta First Nations Information Governance Centre and the Canadian Partnership Against Cancer sought to answer the questions: how do Indigenous communities currently manage and protect their cancer care data? What's being done in cancer research that's led by and for Indigenous peoples? What promising practices are researchers using to understand data and help with cancer care? And how does the Canadian Partnership Against Cancer fit into all of this? Here are some of what we found in the Indigenous Cancer Research and the Cancer Data Landscape environmental scan. Knowledge holders engaged in cancer research have spoken of cancer as having a spirit that requires respect, such as protocols must be followed to ensure any work with cancer does not create additional pain and suffering. In this work, we are called to truly apply ancestral language-based research methods shared by Indigenous cancer patients and Indigenous cancer researchers. As Elder Tom McCollum shared, we are the four-body or four directions people: spiritual, physical, emotional, and mental. The concept of who we are. They are not separate. One affects the other. Cancer touches all peoples worldwide, and the opportunity to present an Indigenous perspective through this environmental scan is an honor. This work focuses on the Indigenous population as a collective cancer journey. The variety of methods and ways communities tackle cancer control research is a field that hasn't been fully explored or understood yet, and each Indigenous population has their own traditional inquiry methods and living examination methodology. As such, Indigenous-led research methodology holds great promise. When the Canadian Partnership Against Cancer, CPAC, granted the Alberta First Nations Information Governance Centre, Alberta FNIGC, the opportunity to conduct an environmental scan, they did so with the understanding it would happen using an Indigenous approach. Knowledge holders prepared the Alberta FNIGC team for the challenges and the obstacles of working from an Indigenous-led approach within a Western-dominated research arena. In this holistic process, Alberta FNIGC engaged the mind, the spirit, the heart, and action to explore the Indigenous concept of data. We used some unique approaches and Indigenous ways, including talking circles and online surveys to gather insights, stories, and knowledge connected to the data. We had elders guiding us, even a data robot named Winston helping out. The shared understanding is that a door has been opened.
The Canadian Partnership Against Cancer must be commended for having the integrity and courage to want to do better as an organization and to answer the Truth and Reconciliation Commission's Call to Action Article 19. We call upon the federal government, in consultation with Aboriginal peoples, to establish measurable goals to identify and close the gaps in health outcomes between Aboriginal and non-Aboriginal communities, and to publish annual progress reports and assess long-term trends. Such efforts would focus on indicators such as infant mortality, maternal health, suicide, mental health, addictions, life expectancy, birth rates, infant and child health issues, chronic diseases, illness and injury incidents, and the availability of appropriate health services. More specifically linking to the TRC recommendation for the federal government take action to address the inequity in the health and medical care available to Aboriginal communities. This research and partnership reflect the creation of innovative approaches and ways of understanding research and data. In the words of TRC Commissioner Wilton Littlechild, to go where there is no path and leave a trail for someone else, exercise a new right for humankind, not just to complain, but offer solutions for consideration. Walk together on that journey.
The environmental scan literature review covered both principles of Western and Indigenous science that have been applied to this research using a mixed methods approach to the environmental scan. Western methods for conducting an environmental scan have been utilized to create outputs, including search plans, websites, database searches, as well as preferred reporting items for systematic reviews and meta-analysis, otherwise known as PRISMAs. Indigenous methods have also been developed to conduct document analysis aligned with Indigenous science and knowledge to provide Indigenous perspectives of outcomes. Indigenous principles applied to the environmental scan phase can be seen in this graphic. The infograph that we generated shows the principles that we applied, and it was led by Indigenous principles for the environmental scan. So within the core principles that we applied was being respectful and respectful handling of utilization of others' knowledge, to be inclusive, looking at it from a systemic process, and engagement of mind, spirit, heart, and action while exploring concepts and data. It was important to be collaborative, focusing on working together with multiple levels of engagement, which of course included our elder knowledge holders along with Indigenous researchers. The other element that was really critical was to apply a humanitarian approach, which was looking at bodies of knowledge, data and information, and the interconnectedness with humanity as a whole, knowing and understanding that cancer is not only impacting Indigenous peoples, but impacts all people in all walks of life. The other important element was to be comprehensive. Because there is so much knowledge, it was necessary to root our work in diversity of knowledge as a strength.
We need a trustworthy Indigenous organization model that's going to support our elders' oral teachings, our elders' knowledges, and somebody that the younger generation can go to and know that the information is more accurate because of who is involved in the research. And like a lot of our elders are very trusted, so we want to go to them.
This looks at the methods and approach that we undertook for the environmental scan. And we approached it from a four-stream environmental scan design approach, following the 4 questions that we had originally came up with. Number 1 was, what is the current state of Indigenous governed and custodianship of cancer care data? We looked at the spirit essence of data from this lens, based on data having linkages to multiple systems, people, and bodies of knowledge. The second question was, what is the current state of cancer care systems research regarding Indigenous specific and Indigenous led? We looked at the historical aspects of data, and knowing that from our perspective, the life of data moves beyond the 7-year typical life of data within a Western model or a Western knowledge base. Most of the time, data is archived after a 7-year period. For Indigenous peoples, data exists from time immemorial. This is one of the reasons why we'll often utilize traditional knowledge systems and understanding of the data that's collected over lifetimes and within family systems as being significant and important. The third question was, what are promising practices of cancer care data with researchers? Knowing that there are multiple data sets and there's multiple structures where data is held, we looked at bodies of data, information, and knowledge. So not only from the Indigenous lens, but also the bodies of knowledge that are being held within these many data structures. The fourth question, where does CPAC fit with Indigenous governed data, research, and cancer care systems? Knowledge and information and the interpretation of these data sets and the application of them. Knowing that there are multiple worldviews, and it was important to translate and interpret these knowledge systems or the data sets in such a way that would help inform not only present time work, but future work as it relates to cancer research and the ecosystem and data as a whole for cancer. The inclusion and exclusion considerations that we applied, we utilized a 4-direction model. So philosophical considerations of inclusion and exclusion criteria. So first of all, we looked at bringing 2 systems together. So the cyclical nature of working within a research and data system. So we looked at creating meaning from within a team, the team members sharing and discovering the findings from the data and research in ecosystems past, present, and future. Secondly, the whole collaboration component, so working together to identify the themes and the true essence of a data story, and then applying the framework, utilizing the tools from the two worlds, inclusion, exclusion, sorting, and prioritization, processing the multiple cycles, and then bringing convergence between the two worlds, coming together to honor the spirit essence of data within the ecosystem of research, people and the bodies of knowledge and data sets, and the systems that data is held in. But number one, it's looking at the collectiveness, collective thinking that guided who leads the team and considering the life of data as a walk and a journey in life. So the factors that we looked at for the inclusion component was the geographic location of the study, timelines, land bases, linguistic groups were prioritized, key organizational competencies embedded in organizational culture. We looked at authorship components, so primarily the papers or the information had to be Indigenous writ, peer-reviewed, or there had to be Indigenous co-authorship between leads, and they had to have a role within the manuscript itself. We looked at effects of change, so Indigenous capacity, prioritized language, utilize and shift of sovereignty included. The other element that we looked as far as inclusion was how much was reported in terms of outcomes and key actions. So the strengths-based approach, whether or not that was included, and aligning with community interests, consideration of community governance and structures. What was also critical as an inclusion factor was whether or not there was reporting on the relationships that were built or the rapport that was developed, whether or not there were well-defined partnerships, whether or not gathering the data and its use was written within their report, and whether or not it informed community program and delivery development. The other component we looked at was the data management and governance piece while they were collecting data or implementing their research, and whether or not OCAP principles were followed.
We will not allow our colonizers to take what was given to us, because only we know through genetic memory something that was taken away from us and given back. We got it back through genetic memory, and it will always be given back in terms of genetic memory. To be able to read the medicine world that the Creator has given us, because we have our medicine cabinet right outside our doors. And we cannot just give it away. It's not ours to give. It was given to us. And we have to make sure that we don't forget it. Our colonizers want to take over our language, but they can't take over our genetic memory. So when we say in the residential school, they took away everything, but our ancestors give it back because we have within our DNA genetic memory.
From the environmental scan and through consultation, we gathered these knowledge holder key messages. Sustain the spiritual nature of oral traditions. Non-Indigenous researchers are challenged in how Indigenous people are with the universe. Western medicine is confronted by ancient knowledge. Maintain intergenerational ancestral knowledge transfer. Indigenous people have been doctors all along, using traditional and spiritual pathways and processes. Establish international linkages with other Indigenous groups. Oncology regulations deny family, yet family is medicine. Work from the similarities between Indigenous and Western health and medicine. Oral tradition and living knowledge are in the stories. Support ancestral research and traditional data, such as medicinal plant knowledge. The spirit of knowledge is found in oral history. Indigenous governance practices come directly from the oral systems. Smudging creates a safe space to speak and follow protocol. Use the circle as venue. Elders are required to sit in those circles. The elder is our oral policy. There are differences between Indigenous and oral system Western written knowledge. The oral system validates and authenticates. Reciprocity is central. Collective knowledge building, example, elders talk, builds human capacity. Oral tradition is at least as valid as written. Living philosophies of governance are perfected through ceremony. Some of the findings that emerged from this project are that 71% of respondents stated collaboration was an important part of their engagement process. Over half, 58% of researchers stated that the data they require does not exist, and 2/3, 67%, stated that the available data does not meet their organization's cancer research needs. 71% stated they were unable to access all the cancer control data needed to support their work.
My parents used to say that, life is loaned to you by the Creator. And every single day I remember that, because I too am a cancer survivor. I've been in remission since 2008. And I've come to realize in my senior years how precious life is. My parents used to always teach us and encourage us to remember all those teachings that they shared with us about our history, our culture, our language, our practices, our spiritual practices as well. Today I realize how critical and important those sayings and teachings were, and when they said you need to know this. And so information is very important. Research is very critical, because we need to leave behind important information, just like our parents left us with so many teachings. We need to follow in their footsteps as well. That's how we know who we are, our identity, our language, our culture, is because of all the information that they've left behind for us.
Data recommendations. A series of impactful recommendations surfaced, steering towards inclusive practices and community empowerment. The first recommendation advocates for a collaborative project to establish a standardized approach for storing Indigenous identifiers across Canada. The subsequent recommendations delve into enhancing data sharing practices in cancer care, creating tailored agreements respecting Indigenous principles, and empowering communities with accessible and disaggregated data. The overarching vision is to empower Indigenous communities, providing them with the tools and agency to actively engage in their members' healthcare journey, culminating in a comprehensive and community-centered approach to cancer care reporting.
In the words of Dorothy Daychief, we never lost it, never did, and we're still very sacred with the strength of the knowledge of our ancestors. We still have them, and they are with us to guide us this way. How we've sustained a lot of our information and awareness.
Research recommendations. A series of recommendations emerged that are aimed at empowering Indigenous communities and reshaping the landscape of data-driven healthcare. The first recommendation advocates for collaboration with Indigenous researchers and organizations to compile a comprehensive list of Indigenous-focused data definitions, measurements, and indicators. Such a centralized repository aims to expedite communication, fostering a shared understanding among researchers and communities. This initiative, integral to Indigenous-led research and data governance, seeks to align metrics with diverse Indigenous perspectives, promoting inclusivity in health measurement. Further, the second recommendation calls for increased funding to support patient-focused and provider-focused Indigenous-led programs, recognizing the unique healthcare needs of Indigenous individuals. Addressing systemic racism, promoting transparency, and empowering communities to voice their concerns, this recommendation seeks to create a culturally safe avenues for Indigenous patients along their cancer journey. Simultaneously, the third recommendation proposes the establishment of an automated system to notify and remind Indigenous patients of screening opportunities, ensuring proactive healthcare engagement, and preventing individuals from being overlooked in the system. This holistic approach aims to enhance follow-up care, facilitate communication, and leverage technology for improved patient support. The fourth and final recommendation emphasizes the pivotal role of funding in bolstering Indigenous-led cancer data research projects, encouraging community-led initiatives, and fortifying the Indigenous presence in the broader data ecosystem. This comprehensive set of recommendations envisions a future where Indigenous communities actively shape and participate in their healthcare trajectory.
Meet the team that worked on the environmental scan of Indigenous cancer research and the cancer data landscape. Leah Bill, Dr. Angeline Latender, Anita Kanzi, Lila Witchy, Melissa Cernigoy, Dr. Sarah Urowich, Oscar O'Neill, Barb Fraser,